Mm-hmm.
Okay. Hi, my name is Emily Hoffer, and today I'm going to be presenting on my evidence-based practice project. And for this, my PICO research question is, how do mothers undergoing cesarean deliveries who participate in immediate skin-to-skin contact in the operating room perceive the birthing experience after delivery? So this is just what my poster turned out looking like. So it has all of the information that I'll be discussing throughout this presentation on it. So to begin, just a little bit about a little bit of a background. So a cesarean section is a surgical procedure involving the delivery of an infant. And it's often due to large infants, or if it's like a high-risk pregnancy, if they're in a breech position, and also if the mother has a history of cesarean section, it might be required that they have another C-section. And then, like I said, at-risk infants or high-risk pregnancies. And then skin-to-skin contact is initiated immediately after birth. This is where the infant has no like clothing or blankets on, and the mother is also bare, and the infant is placed on their chest, so you have that skin-to-skin contact. It can also be done with like a father or another parent or family member, but it's an important bonding experience between the mother and infant after delivery. And then the golden hour is that first hour, like I said, after delivery, where it's very important for that bonding to occur, so that skin-to-skin contact between the mother and infant. And it improves many aspects of maternal and infant well-being. For example, it can help with thermoregulation of the infant since they're not able to regulate their temperature. Improved breastfeeding and bonding has been shown, improved maternal confidence, and decreased stress levels for both the mother and the baby. So when I was doing my research, this is a chart to show how I narrowed down the articles that I used. I found 21 that related to my topic in PubMed and 46 in CINAHL. So the total number of articles identified was 67. From there, I removed the duplicates and found 60 articles, but there were some that just didn't meet my criteria or I wasn't able to access. So from there, I found 24 eligible articles, and then I identified 10 that would work with my topic after reviewing the content. So my first article is the impact of skin-to-skin contact on satisfaction and experience of cesarean mothers, and it was a randomized, double-blinded clinical trial. So this was a level 2 study. It was a double-blind randomized blocks method. So participants were divided into blocks, and each block was randomly assigned to either a treatment or control group. And it discussed immediate skin-to-skin contact in the operating room after a C-section. And there were 105 participants. It started out with 116 mothers, and all the mothers were between 37 and 42 weeks gestation, so only full-term pregnancies. And they had spinal anesthesia, and then APGAR scores had to be 7 or above 5 minutes after delivery. And 5 of the infants didn't meet criteria, and 6 just didn't finish the questionnaire, the mothers. So it ended up with 105 participants total. And in this, skin-to-skin contact was initiated immediately after delivery, and it was continued all the way into recovery. And the control group in this case did not receive skin-to-skin, so they received normal care after a C-section, which is being separated from the infant until they get to the recovery suite and can initiate that skin-to-skin contact. And then in that same source that I found, that it had a p-value of 0.013, which showed that it's very likely that the outcome was caused by the intervention and did not occur by chance. So the confidence interval was 95%, and that showed that we can be confident that the result can be applied to similar groups or populations. And the main finding findings were that there was increased maternal satisfaction and confidence, and decreased maternal pain, increased bonding, and then the cons and adverse effects from this study is that some mothers, instead of having that decreased pain, did experience increased pain because of the positioning, and then discomfort again because of the positioning, and it required frequent repositioning because of the way that they had to hold the infant. It was a little bit awkward. And then the limitations is there were 2 interviewers, so the interviewers are trained on how to interview participants, so it was reduced slightly, but having 2 different people perform those interviews could be a limitation to the study. And then the study did recommend early skin-to-skin contact to improve maternal satisfaction. So exploring the skin-to-skin contact experience during a cesarean section, this is the next study that I used. It was a qualitative study, which is a level 6 study. The ethnography was field notes, individual interviews, and observation. So that was how all of the data was gathered, and it was throughout the process with the mothers, and then observation throughout the delivery and postpartum process. And then it focused on maternal experience solely, and there were 11 participants in the study, but there was no control group. So this article looked at mutual caregiving and how it was beneficial to both the mother and the infant, and it led to a higher level of maternal satisfaction. It also discussed how mothers moved past the adverse effects, which were the increased numbness and discomfort in arms, the need for constant repositioning, and increased stimuli. In the operating room during a C-section, there's a lot of people involved, a lot of different things going on, so it can be very, a lot of stimulation, and so it discussed how they moved past those effects by repositioning and pointing out ways that they wanted the infant repositioned, so it led to less frequent, and then just letting the infant lay differently. So some limitations, they weren't discussed in this article, but it did discuss the recommendations, which were skin to skin creates an atmosphere of mutual caregiving, and that it provides they need to provide additional education and health promotion to mothers in this scenario. And it talked specifically about what the nurses and nurse practitioners say makes a difference in how the mother perceives the birthing process. So it talked about more education and health promotion in those scenarios. So implications to practice that I noticed with this intervention is safety concerns for both the mother and infant with the frequent repositioning and the awkward way that they have to lay. You might need the requirement of an extra nurse to position that infant and just make sure that both the mother and infant are safe. Additional education and health promotion would be needed to provide that mother with education before, during, and after this intervention. And then clinical practice guidelines would be needed, so if a hospital were to implement this, they would need to put specific policies and procedures in place. And then to summarize, skin to skin is not typically completed during a cesarean delivery for many of the reasons that I spoke about today. It can be dangerous for the mother and infant if it's not supervised correctly, or if something were to go wrong. But skin to skin offers many benefits for both the mother and infant. And both studies that I looked at, the random control trial and the ethnography results, supported skin to skin during a cesarean delivery. And the biggest implication to practice is that an additional nurse would be required to be in the operating room to assist with that skin to skin. And then these are my references.